Hello friends, waving hand, welcome back to Mr. Teeth. I'm Bilal, and today's video is about a very common question. After a root canal, can you smoke? This question comes from many patients who either smoke cigarettes, shisha, or even use vaping. In this video, I will explain in detail what happens after a root canal, why smoking is harmful, how long you should avoid it, and what you can do instead. So stay with me till the end. What is a root canal? A root canal is a very common dental treatment, but many people don't fully understand what actually happens in it. Let me explain in simple words. Inside every tooth, there is a soft part called the pulp. This pulp has nerves and blood vessels which keep the tooth alive. When the pulp gets infected, usually because of a deep cavity, cracked tooth, or injury, the tooth becomes very painful. Sometimes, swelling or pus can also form. In the past, if a tooth got infected like this, the only solution was to remove it. But thanks to modern dentistry, now we can save the tooth through a root canal. During a root canal, 1. The dentist removes the infected pulp from inside the tooth. 2. Then the canals are cleaned and disinfected. 3. Finally, the empty space is filled and sealed to stop infection from coming back. So basically, a root canal is like cleaning and repairing the inside of your tooth to keep it in your mouth for many more years. But remember, once the root canal is done, your tooth is not instantly back to normal. The surrounding gums and bone need time to recover. That's why the healing phase is very important. And during this time, you must avoid things that can disturb healing, and smoking is one of them. Healing process after a root canal. After your dentist completes a root canal, the infected pulp is gone and the inside of the tooth is sealed. But this doesn't mean the tooth and surrounding area are instantly healed. Just like when you get a cut on your skin, it takes time for the body to repair itself. The same happens inside your mouth. Small blue diamond. What happens right after a root canal? For the first few hours, the area around your tooth may feel numb because of anesthesia. Once the numbness wears off, you may notice mild pain or soreness. This is completely normal because the tissues around the tooth are still inflamed and adjusting after the treatment. Small blue diamond. How does the body heal? Your body has a natural healing system. After the root canal, 1. Blood flow increases around the treated area to bring oxygen and nutrients. 2. White blood cells move in to fight any remaining bacteria. 3. The bone and gums slowly start repairing themselves. This healing process usually takes a few days to 1 week, depending on your overall health and how carefully you follow aftercare instructions. Small blue diamond. What affects healing? Good habits like resting, taking prescribed medicines, and eating soft foods help healing. Bad habits like smoking, chewing tobacco, or ignoring dentist's advice slow down recovery. Conditions like diabetes or weak immunity can also delay healing. Small blue diamond. Why is healing important? The success of your root canal doesn't depend only on what the dentist did inside the tooth. It also depends on how your body heals afterward. If healing is disturbed, you may get prolonged pain, swelling, or even infection that can damage the tooth again. That's why dentists always say, take care of yourself for at least a few days after the treatment. Why smoking is harmful after a root canal? Now, let's answer the big question. Why is smoking dangerous after a root canal? Many patients think, backhand index pointing right, doctor, I smoke only 1 or 2 cigarettes a day. It should not matter, right? But the truth is, even 1 cigarette can affect healing. Here's how smoking harms your recovery. Small blue diamond. 1. Smoking reduces blood flow. Nicotine makes your blood vessels shrink. When blood flow is reduced, your body cannot send enough oxygen and nutrients to the healing area. Think of it like watering a plant. If water supply is cut, the plant will dry out. Similarly, if blood supply is less, your tooth and gums will heal very slowly. Small blue diamond. 2. Smoking weakens your immune system. Your immune system is your body's natural defense against infection. But smoking reduces the number of white blood cells and their power to fight bacteria. This means if any bacteria are still present near the tooth, smoking gives them a better chance to grow and cause infection again. Small blue diamond. 3. Smoking dries and irritates the mouth. Cigarette smoke makes the mouth dry. A dry mouth is not healthy because saliva normally helps wash away bacteria and keeps the mouth clean. Without enough saliva, the treated tooth and gums become more irritated and more prone to infection. Small blue diamond. 4. Higher chance of treatment failure. Research has shown that smokers have a higher risk of root canal failure compared to non-smokers. This means even after spending money and time on the treatment, The tooth may not survive if you keep smoking. Sometimes, the tooth may need another root canal, or worst case, extraction. Small blue diamond 5. Long-term dental damage. Even if your root canal heals, smoking continues to harm your mouth in the long run. It stains your teeth yellow and makes your breath smell bad. It increases the risk of gum disease, which can make your teeth loose. And it is one of the biggest causes of oral cancer. So smoking is not only dangerous for your healing tooth, but also for your overall oral and general health. Backhand index pointing right. In short, every puff slows your healing and increases your risk. That is why dentists strongly advise patients to avoid smoking, especially right after a root canal. How long should you avoid smoking after a root canal? Now that we understand why smoking is harmful, the next question is, backhand index pointing right, doctor, for how many days should I stop smoking after a root canal? Let's break it down. Small blue diamond first 48 to 72 hours, 2 to 3 days. Most important, this is the critical healing time. Your tooth and the surrounding tissues are inflamed and very sensitive. Smoking during this period can easily disturb healing, cause extra pain, and increase the risk of infection. So, at least for the first 2 to 3 days, smoking should be completely avoided. Small blue diamond first week. Better healing if you can extend it to a full week. That's even better. Why? Because in the first week, your body is still repairing the tissues around the tooth. Every day without smoking gives your gums and bone a stronger chance to recover properly. Small blue diamond long term. Best for your teeth and health. The truth is, even after 1 week, smoking still carries risks. That it slows down long-term healing. It can reduce the success rate of the crown or filling placed on your root canal tooth, and it keeps damaging your gums and bone. So the best option is to quit smoking completely. I know it's not easy, but think about it. You just saved your tooth with a root canal. You invested your money, time, and effort. Why risk losing it again with smoking? Small blue diamond, what if you cannot quit completely? Some patients say, doctor, I cannot quit smoking all at once. If that's the case, at least delay smoking for the first 3 days minimum. Try to reduce the number of cigarettes daily and use alternatives like nicotine gums, patches, or e-cigarettes only as a temporary step. But remember, even vaping is not completely safe. Backhand index pointing right. So the final advice is simple. Minimum, avoid smoking for 48 to 72 hours. Better, avoid for 1 week. Best, quit permanently to protect your teeth and overall health. What about vaping or shisha? Some patients ask, okay, I won't smoke cigarettes, but can I vape or use shisha? The answer is still no. Vaping still delivers nicotine, which reduces healing. Shisha contains even more smoke and harmful chemicals than cigarettes. Whether it's cigarette, cigar, shisha, or vape, all are harmful after root canal. Tips for smokers. I understand quitting smoking is not easy, but here are some tips. Try nicotine gums or patches as a replacement. Keep yourself hydrated. Drink more water. Distract yourself with chewing sugar-free gum. Seek support from friends, family, or stop smoking programs. Remember, you already spent time and money to save your tooth with a root canal. Don't waste it by going back to smoking. So friends, the simple answer is no, you should not smoke after a root canal. At least avoid it for the first few days, but if possible, try to quit completely. Your smile, your teeth, and your health will thank you. If you found this video helpful, please like, thumbs up, share, and subscribe bell to Mr. Teeth for more dental care tips. See you in the next video. Take care and bye. Waving hand.